All right, guys, so it's Caroline, and I have been assigned influenza, which is also known as the flu. The flu is an infectious disease caused by the influenza virus. It is very contagious, and it affects the upper respiratory. There are three types. There's type A, B, and C. A is has multiple species. Sorry, looking over my notes. Multiple species, and it's the most severe. For an example of type A would be H1N1. There's also type B, which is exclusively in humans, and it is most common. And then there is type C, which is less common and typically found in children. The influenza virus spreads through air, so through sneezing and touching surfaces, contaminated surfaces, and then touching, your mouth or your eyes. It reaches its peak in the winter. It's typically like the flu season is typically in the fall and winter, but reaches its peak in the winter. There are 3 to 5 million severe cases a year, and 250,000 to 500,000 deaths worldwide a year. So pretty severe. So let's talk about how your patient will present. Your patient will present either mild to severe symptoms. They'll have a high fever of either 100 to 103. Look at my little patient right here. Isn't she great? Don't judge the artistic ability. Your patient will present with a runny nose, sore throat, muscle pain, headache, coughing, fatigue. See, she's tired. Nausea and vomiting, although nausea and vomiting are not as common in adults as it is in children. So there are some preventions that you can absolutely take to not get this horrid virus. Number one prevention is the flu shot. The flu shot is typically administered, you can begin to receive it in September or October. And it is what scientists, I guess, predict per se will be the strand of the flu that season. So as you know, you can be injected with that strand, which will hopefully prevent you from getting the flu. But it is the first most effective prevention, and you want to make sure that you get your flu shot. So come the end of the summer, when you're just winding down from going to the beach and your outdoor cookouts, and the weather's starting to get a little bit colder and kids are going back to school, that's when you want to say, oh, I need my flu shot. You also want to make sure that you don't touch your eyes, your nose, or your mouth, which can transfer that virus into you. You want to make sure that you cover your coughs, cover your sneezes, and keep surfaces sanitized. A good way to keep them sanitized is using a diluted chlorine bleach. Going back to the flu shot, anybody 6 months or older should definitely get a flu shot. The elderly, women that are pregnant. I'm doing a horrible job holding this. I'm sorry. Women that are pregnant, and then anyone in healthcare or anyone that has a chronic illness. Some nursing interventions. Oh, and hand washing. Hand washing. Hello. Hand washing, hand washing, hand washing is going to be another top prevention. So for our sad, sick patient, we want to make sure that she's getting a lot of rest, that she's getting lots of fluids. She can also take Tylenol. Tylenol is going to help with her fever. It's going to help with those body aches as well. She can take antiviral medications, which, oh God, I'm going to try and butcher right now. Neuraminidase inhibitors and M2 protein inhibitors. Many of us have heard of Tamiflu, which is taken orally, and then Zanamivir, oh God, I'm butchering it, which is inhaled through the mouth, and Permavir, which is an IV, through IV. You'll also want to make sure that someone infected with the flu or influenza is wearing a mask. And then the way to get one of the ways to find out if in fact your patient has been infected with the flu, you can have the rapid molecular assay test done, which is a mucus specimen taken with a nasal or nasopharyngeal swab about 3 to 4 days after the onset, and that will produce a result to let you know whether or not the patient has influenza. Typically takes about 15 to 20 minutes to get that result back. So that is a quick lesson on influenza, the flu. Thanks for listening, and make sure you keep up with your flu shots each year.